Hello, my name is Simeon Nilasha and we're going to be looking this week at the trigger point of the week for the quadriceps muscle, or the quadriceps group of muscles, because it's 4 muscles as the name would imply. So let's just have a little look at the anatomy together. Let's just take the leg and around the knee, because in terms of the quadriceps itself, the pain map usually tends to be around the knee. So someone coming in with knee pain. So let's look at the anatomy. So the rectus femoris, the main muscle of the quadriceps group, runs from the ASIS, the anterior superior iliac spine, and inserts into the superior part of the patella, and it obviously extends the knee. So it's a huge muscle, huge powerful muscle, and it also goes across 2 joints. It is in fact the main hip flexor. We have a small hip flexor, which is the iliopsoas, or the iliacus, and the psoas major and minor, but really they aren't the main flexor of the hip, the quads is. So anyone that presents with sort of hip flexion difficulties or a flexed hip might come in with trigger points. An example of that is this people with OA hip that come in with this kind of slightly flexed forward protective posture, often come in with knee pain, which I think is, in my experience, often associated with trigger points in the quads. So the quads, in terms of the other muscles, we have the Vastus Lateralis, which sort of bonds in with some of the sort of lateral part of the quads, and we have the medialis, which inserts into the medial part of the patella, and the lateralis, which inserts into the lateral part of the patella. So these work together as a group. So in general, the pain map we see very much involves patients with knee pain. So it can be symptoms such as buckling knee, the knee giving way. It can be injured easily with sports. Actually, sometimes people that come in with hamstring problems, they've been water skiing and they tear the hamstring, come in with the sort of, in fact, in general, sometimes we see that when someone presents with a symptom, we have to look at the antagonist as well, because sometimes the agonist is overloaded as a kind of protective mechanism. So someone that's coming in with knee pain, locking of the knee, giving way of the knee, well worth looking for trigger points. The rectus femoris, the big one, the trigger points tend to be right at the top here, around just under the ASIS itself. In terms of the medialis and lateralis, the trigger points tend to be slightly more medial as well. Now, it's a fantastic muscle to treat. It's a great muscle for doing soft tissue work, for doing inhibition compression work, muscle energy techniques, because it really lends itself. It's big, it's powerful, it's superficial. There's also the intermedius, by the way. Intermedius, interestingly, tends to, even though it's deeper to the rest, tends to actually present as pain in the thigh, very deep kind of aching pain. So back to these other maps. People can injure it, as we said, doing sports, skiing, squatting, forced squatting activities. We see it sometimes in people that have done these kind of fitness clubs. And in terms of trigger points in the lateralis, well, there's a ton of trigger points that go down that vastus lateralis. Part of the lateralis actually sits under the iliotibial band, so you actually have some fibers anteriorly and posterior to the ITB, and we can get some incredible twitch responses if you needle into the trigger points, especially in this kind of lateral part of the vastus lateralis. So that's the quadriceps muscle, hip flexor. Again, when someone comes in with knee pain or sort of patella femoral pain, well worth looking at the quadriceps for trigger points. As we said, it's superficial, it's powerful, it's the only real hip flexor, so any hip flexion injury, and of course to be differentially diagnosed with a L4-5 kind of radicular pain or weakness from L4-5 radiculopathy. Trigger point of the week, quadriceps muscle. Hope you enjoyed it, and we look forward to seeing you next week. Thanks very much.